Yes. Alcohol causes cancer, and I know that is not the answer most people want. For years, the message was that a glass of red wine was good for your heart, practically a health food. So let me be straight with you, the way I was with the patients I worked with as an oncology dietitian. Alcohol is a proven human carcinogen, and the risk starts lower than almost anyone realizes. Here is the hard part first. In January 2023, the World Health Organization's European office said it plainly: when it comes to cancer, there is no safe level of alcohol, not one that protects you. The International Agency for Research on Cancer classifies alcohol as a Group 1 carcinogen, the same category as tobacco and asbestos. That does not mean a beer is as dangerous as a cigarette. The group is about how confident we are that something causes cancer, and for alcohol, the confidence is complete. Now the mechanism, because this is where it stops being a scary label and starts making sense. When you drink, your body breaks ethanol down into a chemical called acetaldehyde. Acetaldehyde is the real troublemaker. It binds to your DNA, damages it, and gets in the way of the repair crew that would normally fix the damage. Damaged DNA that does not get repaired is exactly how a normal cell takes the first step toward cancer. Alcohol also raises certain hormones like estrogen, which matters for breast cancer, and it acts as a solvent that helps other carcinogens, like the ones in tobacco, slip into the tissues of your mouth and throat. That mechanism is why alcohol is linked to a specific list of cancers, not a vague fear. The evidence connects it to cancers of the mouth, throat, voice box, esophagus, liver, colon and rectum, and the breast. That breast cancer link is the one that surprises people most because the risk is measurable even at light drinking. Large pooled studies find that even about 1 drink a day raises breast cancer risk by a small but real amount, and it climbs from there. Let me put the size of it in perspective, because honesty runs both directions. For most cancers, the risk from light drinking is small in absolute terms. 1 drink a day does not doom you. But small times millions of people is a large number of cancers, which is why this is a public health message and not a personal verdict. The more you drink and the longer you drink, the more the risk stacks up. Heavy drinking is where the danger becomes steep, especially for the mouth, throat, and liver, and especially when it is combined with smoking, because the two multiply each other. So what about the red wine and the heart studies? Here is what happened. A lot of those early studies compared drinkers to non-drinkers without noticing that the non-drinker group included people who had quit because they were already sick. That made moderate drinkers look healthier than they were. Newer analyses that account for this find the heart benefit mostly shrinks or disappears. And even if a small heart benefit existed for someone, it would not erase the cancer risk sitting right next to it. The resveratrol in wine, the compound everyone points to, exists in amounts so tiny you would have to drink yourself sick to reach the doses used in a lab. Here is what I want you to actually do with this, because I am not here to run your life. Less is better than more, and the biggest gains come from moving away from heavy drinking. If you do not drink, this is not a reason to start for your health. If you do drink, you get to weigh a real cancer risk against the role alcohol plays in your life, and that is your call to make with clear information instead of a marketing slogan. If you are in treatment or recovering from cancer, this is worth a direct conversation with your oncology team, because alcohol can interact with treatment and with the tissues that are already healing. Alcohol is one of the most normalized carcinogens we have. That does not make it evil, and it does not make you reckless for having a drink. It just means the wine was never the health food, and you deserve to know that when you decide.